Proposed bill in Iowa would eliminate education requirements on public schools for certain topics related to sexually transmitted diseases.
House File 187 would cut the requirement to educate students about human papillomavirus, also known as HPV, and associated vaccines.
KTIV's Clayton Anderson has reaction to that proposal from local public health officials.
The proposed bill focuses on keeping health and human development education age appropriate, as the bill would eliminate the requirement for health curriculum to include information on the availability of a vaccine to prevent human papillomavirus, also known as HPV. Tyler Brock with Siouxland District Health says HPV is a common sexually transmitted disease among young people that could lead to cancer.
HPV is a virus that can cause a lot of problems later on in life, okay? And some of the cancers that are associated with HPV, we really want to work hard to prevent those, and there's ways to do that.
And while officials here at Siouxland District Health believe that sex education inside the classroom is important, they say it is only part of what goes into the whole entire makeup of education.
We want to continue to encourage some of this education to be done in the schools, but we know that's just one piece of this, and it's a much bigger, there's many other factors that contribute to people's health.
In a statement, a spokesperson for the Sioux City Community School District said in part the district curriculum uses age-appropriate and evidence-based instruction to teach students content related to human growth and development through our science, social studies, and health courses as required by current Iowa Code 279.50. In Sioux City, Clayton Anderson, KTIV News 4.